So in this week's update from IHME on modeling and analyzing the COVID epidemic, first, in terms of what's happened around the world that is not following the trajectory that we expected, really the only major observation on that front is that the increase in cases in the Russian Federation and perhaps Belarus is continued to rise. We expected, because past infection levels we've estimated to be very high, they should have run out of people to infect. They've kept going. And so we expect that peak should come soon. But of course, the fact that it's kept going may imply that levels of past infection have not been as high as we previously expected. Second observation is that, in fact, the Omicron wave is going down faster in some regions than we expected, or somewhat faster. The Caribbean stands out. Actually, South America in general stands out as declining faster than perhaps we expected. And then there are a handful of anomalies that we are observing around countries where, after a decline, cases have gone back up. Finland is included in that. Sardinia would be in that group. Manitoba province in Canada. And in each of these, we're not sure what the explanation is. It could be a local phenomenon around increased transmission or spatial spread. In the case of Finland, it may be the same thing that happened in Denmark, the spread of the BA2 variant. But certainly, these are not happening in a large number of locations and seem to be specific to those particular places. Our global numbers do look different because of China, where we expected that by now the Omicron epidemic would have taken hold more broadly in the community, and we would be seeing widespread transmission. And the public health authorities in China, through vigorous lockdown, have been able to stop transmission in Beijing. And we are therefore pushing out later into March and April what we continue to expect will happen, which is that there will be a widespread Omicron wave. So at the global level, that makes a difference. The last thing to note is that as part of our analyses, we are going to be including what's in the models for quite some time, the fraction of people in each population that have got functional immunity to Omicron. And that immunity comes from vaccination, even though vaccines are only partially effective for blocking Omicron infection. It comes from past infection, it comes from other variants, and it comes from infection with Omicron. And in each case, we compute that functional immunity taking into account the pattern of waning for vaccination and for natural infection, and the cross-variant immunity, or the breakthrough that Omicron has against prior variant infection. When you put all that together in a place, for example, like the United States, we see about 3/4 of the population currently are immune to Omicron. And we expect that number will continue to grow as we go through the sort of tail end of the Omicron wave in the United States. Does that mean that because so many people are immune to Omicron, that we will see no further transmission or waves of COVID in the future? The answer is no, because we will have, if no new variant emerges, we would expect Omicron to return next winter. There'll be more waning of immunity, more people will have gone back to being susceptible, and we'd be back into winter intensified transmission. Of course, we do think new variants will emerge, and so further increases or outbreaks are likely as new variants emerge that have immune escape and can infect people that are currently immune to Omicron. We don't expect those new variants, however, to have the same consequence that, for example, the Delta variant had last year, because global levels of immunity are going to be much higher, and there's the advent of access, we hope, that will eventually be global, to antivirals, which will substantially reduce the infection fatality rate. So those are the main insights from this week's analysis.